You've probably read a study, thought, that's interesting, and then nothing changed in your daily practice. The real challenge isn't just reading research, it's translating it into decisions for your patients. Today, I'll show you how I make that leap step by step. Step 1. Start with the clinical question. Everything begins with a real patient. Let's say someone asks about tooth whitening safety. My clinical question becomes, does whitening increase sensitivity long term? That's the filter I use when reading. Step 2. Read with the question in mind. When I open a paper, I'm not memorizing tables. I'm asking, does this answer my patient's concern? If it's a clinical trial comparing whitening gels, I focus on the outcomes about sensitivity, not all the side details. Step 3. Translate numbers into plain words. This is where patients get lost. If the paper says relative risk of sensitivity equal 1.2, p-value below 0.05, that means nothing to them. I'll translate it. Patients who whitened teeth had a slightly higher chance of temporary sensitivity, but it went away in a few days. Simple, clear, and honest. Step 4. Put it in context. Evidence is never the only factor. I ask, does it apply to this specific patient? Age, habits, expectations, all of that matters. A study may be correct, but it's my job to adapt it to the individual in front of me. Step 5. Use it in the conversation. Finally, I bring it back to the patient. Instead of saying studies show significant difference at p below 0.05, I say most patients do get some temporary sensitivity with whitening, but it usually disappears quickly. If that happens, here's how we manage it. That's translating papers into practice. So the chain is simple. Start with the real patient question. Read with that question in mind. Translate the statistics into plain words. Adapt it to your patient's context. Use it in the conversation. Evidence only matters when it helps patients make better decisions. In the next video, we will look at something that often distorts research, bias and conflicts of interest, and how to spot when studies are not as neutral as they look. If this episode gave you a clear way to move from paper to patient, hit subscribe so you don't miss it.